What is COVID-19? In December 2019, there were many reported cases of pneumonia in the city of Wuhan in China. Pneumonia is an infection in one or both of the lungs, sometimes called a chest infection. So what did all of these cases have in common? Everyone showing signs of illness had been to a live animal market in Wuhan. The cause of sickness in these patients turned out to be a previously unknown virus, now called the 2019 novel coronavirus, or COVID-19. The disease has since spread from those sick to others like family members and healthcare workers. The World Health Organization has called the coronavirus outbreak a pandemic, which is a word used to describe a new disease that quickly spreads around the world. What is the structure of the virus? Coronaviruses are made up of a core of genetic material that is surrounded by an envelope with protein spikes. They tend to look like crowns, which is also known as corona in Latin, hence the name coronavirus. How does it spread? The exact method is unknown, but like most respiratory infections like the common cold or the flu, this virus spreads through droplets from sneezing or coughing, or through objects that have been contaminated with the virus, like doorknobs. The time from virus transmission to symptoms can be anywhere from 2 to 14 days. What are some signs and symptoms of coronavirus 19? In the early stages, you may see fever, coughing, and shortness of breath. In more severe cases, you may see pneumonia, kidney failure, and sometimes death. How can we identify if someone is sick? Step 1. Collect a sample from inside the patient's nose or the back of their throat. This process can be quite uncomfortable. Step 2. You separate the genetic material of the virus from all of the other gunk, like the human cells, proteins, and enzymes. Step 3 is to run the sample through PCR, which stands for polymerase chain reaction. In this test, small amounts of genetic material of the virus can be copied until there are millions that the scientists can analyze and diagnose with. There are currently no treatments or vaccinations available for COVID-19. Current management is supportive care, like taking Tylenol and drinking fluids. So how do you protect yourself and others to stop the spread? Number 1, you can wash your hands frequently with soap and water or alcohol-based hand sanitizer. Number 2, try to avoid close contact with those that are unwell and practice social distancing, like staying home. Number 3, cover your nose and mouth when coughing or sneezing using the bend of your elbow or a tissue, and avoid touching your face. Lastly, use personal protective equipment appropriately, such as masks and gloves, especially when you're in healthcare areas like hospitals. So, why are we staying home? By taking protective measures like staying home, washing our hands, and not touching our faces, we can together help decrease the number of new COVID-19 cases and also support our healthcare system. There is a limit to the number of beds and resources available to support patients, so we don't want to overwhelm our healthcare system.